Welcome back, everyone. There is a solution for people who have been suffering from long-haul COVID, PTSD, and anxiety. Dr. Gregory Conde is the owner of Aspen Orthopedic Pain and Spine and is joining me in the sponsored interview and with Pam, who is a patient. Pam, thank you so much for joining us as well.
Thank you.
This is groundbreaking treatment for COVID, but not necessarily when it comes to your pain and spine treatment. Explain it.
We've been doing this procedure for years for head and neck and arm pain, but since COVID hit, they thought and did some research on doing this for losing taste, losing smell, fatigue, brain fog, all the things that we can't stand after getting COVID that doesn't go away.
So explain how the connection between this injection and how it does affect everything when it comes to the symptoms of long COVID.
So the hypothesis is that the COVID affects your nervous system. It goes out of whack. And this procedure helps reset the nervous system. So your heart rate, your brain fog, your taste, your smell, it's all connected. And by numbing this nervous system, this bundle of nerves in your neck, it resets the system, just like shutting off the switch and turning it back on.
Because normally someone who comes into your office has neck pain, back pain, all sorts of symptoms, and they get this nerve block, in essence, this injection, and it relieves the pain. So the same concept goes with long COVID or PTSD and anxiety.
Correct. It has to do with the sympathetic nervous system. It's automatic. It's behind. It's going without even thinking about it. It's your fight or flight response. You rest and digest. So when this gets out of whack and gets left on, like for instance, someone who has a trauma and has PTSD, they have all these symptoms of nightmares and triggered and anxiety. By shutting down that nervous system and resetting it, it allows those symptoms to dissipate and go down. Same with long haul COVID, that something about that virus reacts and knocks up this thing and they won't turn back off. And so by calming the nervous system down, the sympathetic nervous system, it allows everything to reset. And so people can taste and smell again.
Pam, I'm bringing you in. You were nodding because explain your long COVID. What were the symptoms and how you were treated?
Okay, so I completely lost my taste and my smell, and I was not able to taste and smell for about 3 years. Like
3 years?
Yes, insane. I was only able to taste like sweet, sour stuff, but that's it. No taste or smell at all. And after the procedure, I can eat cheeseburgers, hot and spicy. A lot of candy is my favorite for this bag.
So how many treatments did you go through and you realized, oh my goodness, my taste is coming back?
So I had 2. So the first one went great, but then I went for the other one, and it's life changer.
100% back?
Yeah, I'm able to taste, smell, everything.
So for 3 years, your taste buds were not right?
Yeah, I tried like, essential oil stuff, a bunch of stuff, but they didn't come back until I had the procedure.
And so how did you two connect and realize, wait a second, this treatment we've been dealing with some of your other patients, we can help Pam?
Yep. She just found out about the procedure and called us up. And
I was crazy to get my taste and my smell back because 3 years without it is insane.
And so I'm wrapping my brain of this injection can also affect your taste, your smell, and all of those symptoms?
Right. It's the bizarre thing about COVID. It keeps giving us gifts that we don't want. So it's a neuroendocrine, sympathetic maintained. Basically, it's a wacky nervous system that we're just trying to reset and remind it that it's supposed to work a certain way.
Dr. Conde, can you explain not just Pam, but some of your other patients who have had these success stories? What other symptoms are they coming in with?
So we've had people who've come in who've had the brain fog and the fatigue and their heart rate where it doesn't take much to get their heart rate going really fast. When they come in, they do the shot. They've said within 24 hours, even a few weeks, everything's back to their normal baseline. They're able to function again without all the symptoms they were struggling with before.
And so when you described you're resetting your nervous system, that means, do you have to even come back, or is it good after that?
We don't know how long it's going to last. When it's a nervous system that acts like its own, but so far we've had a lot of good results where it's lasted 3-4 months up. Some people haven't come back.
And Pam, when was the last treatment that you had? I mean, you only had 2, but how long has it been?
It was probably like 2 weeks.
Okay.
Yeah, like 2 weeks, and it was like super fast. Like, I just had the procedure done, and then my mom was chewing one, and I was like, Are you chewing gum? I can smell that.
Chewing gum, and you could smell it.
I could smell it.
Okay, well that's really amazing. I'm so happy for you.
Thank you.
You can find the Aspen Orthopedic Pain and Spine. They are also offering a 10% discount with the code GTU. Thank you so much, doctor.
Thank you so much for having us on.
Thank you.
Thanks to Aspen Orthopedic Pain and Spine for that sponsored message.